Addiction. We've all heard of it. At some point in our lives, we will likely know someone who is struggling with it. In fact, nearly 21 million Americans have at least one addiction, and nearly half of all Americans have a loved one who has struggled with a drug addiction. 3% of the population struggles with a gambling addiction. 3 to 6% of Americans suffer from a sexual addiction, and around 10% of the population struggles with an eating disorder. So what is addiction? A weakness? A lack of willpower? A lack of morals? No. Addiction is a brain disease. When someone uses something addictive, it triggers a huge release of dopamine, a pleasure hormone in our brains. As they keep using, the brain starts to rely on that addictive substance or behavior to feel good. As far as the addict's brain is concerned, that drug is as important as food. Getting the next fix isn't just about satisfying a craving, it's a matter of survival. That's what makes addiction so hard to overcome. When someone becomes addicted, they compulsively use the substance and lose control of their ability to stop, even though they are faced with countless negative consequences. There are many signs that someone may be struggling with an addiction. These include alarming changes in behavior, problems with work or school, poor hygiene, lashing out when asked about their substance use, lying and stealing to feed an addiction, drastic mood swings, and withdrawal symptoms when they can't get a fix. So what do you do when someone you care about confides in you that they are struggling with an addiction? Don't respond like this. How could you do this to your family? Why can't you just stop? You should have known better than to get mixed up in something like this. Don't shame or guilt them, and don't judge them. Instead, love them. Recognize that they aren't their addiction. Speak with optimism and possibilities. Set healthy boundaries, and encourage them to keep getting the help they need. Just be there for them. Denial is a huge roadblock on the road to recovery. When they've confided in you, be proud of them for taking the first step. Now more than ever, they need support. Recovery works best when there is a lot of support and encouragement. It cannot be done alone. Addiction is hard, but the good news is that it can be treated. Treatment requires time, effort, and support. It's not easy, but it's possible. Addiction treatment can include inpatient treatments, which includes detoxification and medical evaluation, individual or group therapy for both the addict and their family, support groups such as AA or the 12-step program, medication to treat mental illness that can accompany an addiction, life skills training, and learning how to recognize and cope with triggers. Successful treatment will involve several of these things, all working together to heal the whole person. It is important that the entire family is involved in treatment because addiction is a family disease. A few words on relapse. It happens. In fact, it's to be expected on the road to recovery. That doesn't mean that treatment isn't working or that a loved one has failed. It usually takes 3 to 4 false starts before an addict can achieve a year of sobriety. And it can take up to 8 or 9 years for this to happen. So be patient and encourage them to keep going. If you think someone you love is struggling with an addiction, talk with them. Express love, concern, and encourage them to get help. A well-thought-out intervention aimed at helping an individual can guide them to treatment. But it isn't your job to force them to get help. It has to be their choice. Let's recap. Addiction is a brain disease that can have devastating effects on everyone involved. But successful treatment is possible. If you know someone struggling with an addiction, stand by them. Set boundaries and encourage them to seek treatment. And get help if you need it too. Be part of their support system, and the wounds from addiction can be healed.